So when it comes to bleeding disorders, I mean, not all of them are hereditary, but having said that, a larger number of these disorders are hereditary. So if I further categorize it based on the platelet disorders and the disorders of coagulation, so platelet disorders are again it can be subdivided into two. First of all, where the platelets are lesser in number. So bone marrow produces red cells, it produces white cells, and similarly it produces platelets. If because of some reason the platelet series is not functioning properly in the bone marrow, that can lead to decreased number of platelet production. Okay, so those are factors which lead to inherited thrombocytopenia. Note this is a quantitative, that the number of platelets are less. Occasionally we see patients where the numbers are normal. So platelets might be normal in number. So the normal range is 1.4 lakhs to say 1.5 lakhs to 4.5 lakhs, or 150,000 to 450,000. It depends from at different ages, but that's a rough sort of wide range of platelets. So if the platelets are out of this range, so that is also, it can be either qualitative or a quantitative. So quantitative, lesser number, but if the platelets are in normal range, between this range, still the functionality might be affected. So that we call it as a qualitative platelet defect. Okay, so those are again some inherited or hereditary platelet disorders where the quality of platelets is not good. So the functionality is also affected. The number might be normal. So this is about the platelet disorders. Then moving on to clotting disorders, the factors. So the commonest ones is, as I said, hemophilia. Okay, so hemophilia A or B, where either the factor 8 is affected or the factor 9 is affected. Now these are two very important factors for normal coagulation cascade. So as I said, as soon as the injury happens, okay, so there is a cascade of event which happens inside the body or in that area. Okay, and so the first thing is that the vessel gets constricted, the platelets come into action. Platelet tends to get accumulated in that particular area, so that a platelet plug is formed. Then on the surface of these platelets, other coagulation factors tend to sort of work and form a formal clot. Okay, what we call it as clot. Okay. So if these factor 8 or factor 9 is deficient, then this clotting is affected, okay, and which is commonly known as hemophilia A or B, whether it is factor deficiency. If factor 8 is deficient, factor 9 is deficient. Now these are the commoner causes. There are other factors also which can be deficient, which can also increase the risk of bleeding. But these are the commoner ones which we know, which we are more familiar with.